When you hear WHO, most people imagine something distant, abstract, and detached from everyday reality, as if it were an institution that exists only on paper, somewhere on the other side of the world. But the truth is completely different. The World Health Organization affects our lives far more than we realize. From the food we buy, to the vaccines that protect our children, to recommendations that influence hygiene, water quality, hospital procedures, and even how countries prepare for epidemics. Imagine an organization that can connect doctors, scientists, and health ministries from completely different corners of the planet within a few hours, evaluate data from dozens of hospitals, analyze the movement of viruses, the annual occurrence of diseases, but at the same time sets limits for chemicals in food, or controls the quality of drinking water in areas where people practically cannot survive without clean water. Yet most people have no idea how huge an influence the WHO has on our daily lives. That is why today we are going to do something that regular news does not do. We will explain what the WHO really is, what its role is, why it exists, what it does in practice, how its decisions reflect on our everyday reality, and why we should care that right now, today, it is facing one of the biggest challenges in decades. Who is the WHO and why was it created? To understand why the WHO exists, we must go back to the period after the Second World War. People then saw how easily infections could spread in conditions of famine, chaos, and migration, when health systems were overloaded or did not exist at all. Epidemics back then were not just a matter of one city or state, but spread across the continent, and nations realized one fundamental thing. Health ceases to be just a national problem and becomes a global problem. In the year 1948, the WHO was created as part of the UN, and from the beginning was given a clear task: to coordinate global health policy, protect people from diseases, unify healthcare standards, and ensure that even the poorest parts of the world had access to basic health services. Today, the WHO has 194 member states, which means almost the whole world, and its headquarters in Geneva has become the center of a huge international network of scientists, experts, doctors, and researchers. But the WHO is not a political body or a government office. It is more like a global brain that analyzes data from different parts of the world, issues recommendations, monitors risks, and helps where it is needed most. Its influence is not limited to developing countries. Its decisions are reflected in our modern lives too, whether it is limits on contaminants in food, vaccination programs, or strategies for monitoring diseases. What the WHO really does. When a person hears the name WHO, they often recall press conferences during COVID or general health recommendations, but that represents only a very small fraction of their actual work. The main activity of the WHO takes place in the field, in laboratories, in digital systems, and in coordination centers where health information from all over the world converges. For example, the WHO monitors diseases in real time. This means it collects data on the occurrence of infections from thousands of laboratories and hospitals, which are then analyzed and evaluated quickly enough to catch a threat even before it becomes a problem. With diseases like cholera, malaria, or new viral infections, the speed of data evaluation can equal hundreds or millions of saved people. Another huge area is setting global standards. The WHO creates recommendations that influence water quality, food safety, hygiene procedures in restaurants and hospitals, limits for toxic substances in food, rules for handling chemicals, or recommendations for the correct use of antibiotics. When the WHO sets the maximum admissible amount of acrylamide in fries, or limits for pesticide contamination, these standards are often adopted globally and influence local regulations everywhere. The WHO also conducts education and support for health workers in countries where there is a lack of resources. It helps build hospitals, provides medicine, equipment, and trains doctors. And in situations where a natural disaster or armed conflict strikes, the WHO launches emergency health teams that are capable of arriving at the affected places as one of the first. It is not, therefore, an organization that just says something. It is an institution on whose recommendations a large part of modern healthcare stands, from nutrition and disease prevention to monitoring new risks and supporting medical research. How the WHO affects your health. You might be thinking, okay, the WHO is important for the world, but why should that interest me personally? The answer is simple. Because without the WHO, your life would look completely different today. Every day we use norms and standards that were created precisely at the WHO. When you buy food that is free of heavy metals, pathogens, or excessive toxins, it is partly because the WHO set limits that act as a global benchmark for safety. When you can be relatively sure in a restaurant that hygiene works, because there are clear rules for kitchen cleanliness, disinfection, and food handling, those rules have roots in WHO recommendations. Likewise, recommendations concerning antibiotics have a direct impact on your microbiome. The WHO has long warned that the excessive use of antibiotics leads to bacterial resistance, which means that common medicines stop working. That is precisely why doctors today prescribe antibiotics more carefully than 20 years ago. That is not a whim. That is a consequence of scientific recommendations from the WHO, which is trying to protect the future of medicine. The quality of the water we drink is also, to a large extent, the result of standards that the WHO set. And if you have ever wondered why we generally have safe drinking water available at the turn of a tap, then believe that part of the credit belongs to the WHO and their correctly set recommendations. And then there is one more aspect: prevention. The WHO issues essential recommendations regarding nutrition, stress, sleep, mental health, physical activity, and also toxins in food. If you have ever heard that you should limit sugar, that fried foods can increase inflammation, or that trans fats belong among the most dangerous components of a modern diet, then this information often has its origin precisely in research that the WHO coordinates or supports. If you are enjoying this video so far and it makes sense to you, I will be glad if you support us with a subscription or a like. We create content based on science, common sense, and practical experience, without exaggeration and without scaremongering. And when you let us know that such content has value for you, it helps us get this information to other people. Why we need the WHO. And now, try to imagine a world where the WHO does not exist. States do not share information with each other about the spread of infections, so epidemics that could be solved in time spread across continents. Poor countries without access to medicine and health workers would become the source of massive epidemics, which would subsequently reach developed countries too. Hospitals would not have unified recommendations, and medicine would develop much more slowly because global oversight of research would be missing. And above all, food safety would be in the hands of individual states, which would mean huge differences in their quality and safety. The WHO functions as a safety net. When a problem appears somewhere, states know where to turn, and the WHO knows what steps to take. It can connect information, create a plan, and direct resources where they are needed most. Without it, the world would be much more chaotic and less safe. Maybe it is an institution we do not see, but we feel its influence every time we turn on a tap, buy food in a store, get treatment in a hospital, or when the world faces a health threat. The biggest challenges of the WHO in the year 2025. The year 2025 represents for the WHO one of the most critical periods in its modern history. Health threats are accelerating, globalization brings new types of risks, and humanity faces a combination of problems that reinforce each other. Antibiotic resistance causes infections that were previously trivial to become dangerous again. Climate changes lead to the spread of mosquitoes, tropical diseases, and contamination of water sources. The number of chronic diseases is growing, such as obesity, diabetes, or heart diseases, which represent a huge burden for health systems and prolong waiting times. One of the most serious topics, however, is the lack of trust. Misinformation about health spreads faster than facts and undermines the efforts of doctors and experts. Added to all this is the tension from migration and poverty, where millions of people do not have access to basic health care. The WHO must solve multiple crises at the same time, more than ever before. And although it is not talked about much, its capacities are stretched to the maximum. The point, impact, and why it all makes sense. And now, when we already know what the WHO does, why it was created, how it interferes in our lives, and what challenges it solves, comes the question that is perhaps the most important of all. Why should we care right now? Why should an ordinary person who deals with family, work, daily stress, or their own health care what a global organization thousands of miles away from us is doing? The answer is simple. Because health is not isolated. It is not closed within the borders of a state. It is not dependent on where you live or how rich your country is. Health is connected. And this connectivity means that problems on one end of the world will sooner or later manifest on the other. When a new form of malaria appears in Africa that does not respond to available medicines, it is only a matter of time before it appears elsewhere. And the WHO is the only organization that has the capacity and contacts to monitor it, look for solutions, and set procedures that protect millions of lives. When food contamination appears in Asia that can affect global production, the WHO provides information, limits, and warnings, thanks to which similar problems do not get to other parts of the world. And when a humanitarian disaster occurs that threatens the basic healthcare of millions of people, the WHO is often the first to arrive with equipment, medicine, and teams of experts. In the modern world, it is not enough to just solve consequences. It is necessary to solve causes. And that is precisely the area in which the WHO plays a key role. It points out problems that are not yet visible, collects data, analyzes trends, and can predict risks that individual states would not catch at all on their own. The WHO knows how to put together information that originates in the field, in hospitals, in laboratories, on universities, and in international organizations, and creates from them a picture of the world that is more accurate than anything individual governments have. And that is exactly the point. Without the WHO, the world would not be blind, but it would definitely be short-sighted. We would only see what is happening on our own doorstep. We would not have an overview of what is happening 1,000 miles away, even though precisely that often decides our safety, health, and future. What the WHO does is most evident in moments when nothing is happening, when no epidemic is raging, when borders are not closed, when the world functions normally. Such a period of calm does not exist by chance. It arises thanks to the fact that someone is constantly monitoring risks, evaluating data, setting procedures, and coordinating states so that problems are solved before they explode. And this is work that we, of course, do not see. But precisely invisible things are often the most important. The WHO stands behind hundreds of successes that never get into the media. Thanks to their recommendations, diseases that once killed millions of children have been eliminated. Thanks to their programs, the spread of AIDS has been slowed down, millions of patients with tuberculosis have been cured, and whole generations have been protected from diseases that recently meant certain death. And thanks to their standards, today we have safe drinking water, quality food, and hospitals that follow hygiene procedures. Our idea of a world where we can travel, eat safe food, drink water from the tap, and rely on modern medicine is not a given. It is the result of decades of coordination, cooperation, and prevention that the WHO led and leads to this day. And in the year 2025, when health systems face a combination of climatic threats, new infections, misinformation, migration, and funding crises, the role of the WHO is more important than ever before. At a time when the question of where to cut costs is being addressed, it is good to remember that without coordination, there is no health. Without shared data, there is no safety. And without prevention, even the best systems are doomed to just put out fires that are already burning. And that is the reason why the WHO matters. Not because it is in Geneva, but because it holds together a world that without it would look much more chaotic, dangerous, and less predictable. If you watched this video up to here, I really appreciate it. The world of health is sometimes complicated, full of abbreviations, unclear recommendations, and pressures from various sides. And that is precisely why it is important to have a place where information is presented clearly, humanly, and without unnecessary scaremongering. If this video helped you understand how the WHO works and why its work affects our daily life more than it might seem, I will be glad if you support our community. Just subscribe, like, or share the video. You will help not only us, but mainly people who are interested in health and are looking for information they can trust. Here at Real Fix Health, we try to show that health is not just about medicines and diagnoses. It is about understanding how the body works, what benefits it, and how small things can make big differences. And if you want to be here for the next part, where we will look at why the WHO warns against drastic cuts in funding for world health and what consequences it can have for all of us, definitely stay with us. Thanks for being part of this journey. Follow us, share, comment, and most importantly, take care of your health. It is the most valuable thing you have.